Hi everyone, my name is Willem BJ from BM123. I'm one of the part-time student librarians here. So today I'll be reviewing the book on Rubin's Pathology, Mechanisms of Human Diseases. This is the 8th edition, accessible via Vital Source. So let's look at what is the content of this book. So this book has been divided into 3 parts: the mechanism of diseases, pathogenesis of systemic conditions, as well as disease of individual organ systems. So let's have a look at each one. There are 34 chapters in this book, and under the first section of mechanisms of diseases, they'll be discussing on the foundational pathology knowledge, so such as cell adaptation, injury, death, inflammation, repair, regeneration, fibrosis, as well as cancers and the common etiology behind most pathological conditions. So this is in genetics, developmental, environmental, and nutritional pathology. So under the next session, pathogenesis of systemic conditions is where the pathogenesis is seen under the systems, so such as aging, systemic autoimmune diseases, sepsis, which is a infection, obesity, diabetes, and harmful sequelae, pathology of pregnancy, so this is what happens during pregnancy, and systemic amyloidosis. And now for the third section, diseases of individual organ systems. So this will focus more on the individual organ systems within the human body and the pathologies present in them. So we've got blood vessels, we've got respiratory system, GIT, kidney, urinary tract, reproductive system, the integumentary system, the head and the neck, the eyes, the CNS, the PNS, the skeletal muscles. So all this will be touched within this book, even forensics pathology. So now let's have a look at one of the particular chapters to have a look at what this book entails. So we will look at the gastrointestinal tract, the GIT. So this will be under the third section, which is diseases of individual organ systems. So now this book has many illustrations to allow for students to visualize what they're learning. So you can see here, it's all in color and illustrated clearly. We've also have real life photos. This is a illustration of a radiograph. We've also pictures of real life tissue specimens, as well as histological specimens. So these are all real images to allow students to actually get not particularly a hands-on, but a better understanding of what is expected in the lab and in the clinic, in a clinical setting, and what is the processes that might be happening, the key features of pathologies that are observed. So here we can see quite a number of diseases under the GIT, such as Barrett esophagus, which is a cancer of the esophagus. We can also see infective esophagitis, which is caused by Candida. We see Candida here, we see herpetics here, as well as multiple sections within a chapter itself featuring clinical epidemiology, etiological factors, pathology, which is the pathogenesis, as well as the clinical features. So this is quite useful for biomedical science students as the content is brief, clear, and concise. So all this is just getting a general understanding of the condition without going too in-depth, but understanding the fundamentals of that particular pathology, as well as the histological samples. So this will help a lot in biomedical science students before they go into the diagnostic clinic. As for medical students, as seen here, the clinical features here would help a lot with diagnosing a patient, understanding the conditions. The epidemiology also allows them to get a history of the patients. However, the book does not discuss much on treatment and management of diseases, rather only the pathology and pathogenesis of it. So this may be helpful, but not more so a supplementary reading towards other medical books. So I would definitely recommend this book as it is clear, concise, very easy to load, very easily accessible, and the pictures here are very clear, explanations are clear, concise, and not too wordy, and easy to read. So here we can see more histological samples. These are stained with periodic acid shift stain. So this can be an aid to biomedical science students to understand histology features as well as the common staining features under a microscope. So all this would go back down to aiding students to further understand the conditions later on to assess it during the work. And that is all from me for this book. Thank you so much.